Next, we will hear from Dr. Chyrell Bellamy, an associate professor in the Department of Psychiatry. She is the director of Yale's Program for Recovery and Community Health and serves as a senior policy advisor to the Connecticut Department of Mental Health and Addictions. Dr. Bellamy has experience as a frontline service provider, a community educator and organizer, and as a community and academic researcher. We are grateful Dr. Bellamy is with us today to share more about peer support and culturally responsive approaches to mental health care. Dr. Bellamy?
Thank you so much, Catherine, for that introduction. It's a tough act to follow after Dr. Duckworth. Very excited to hear about the book that you did for NAMI, and particularly that you're honoring lived expertise. So I'm happy to get, I'll be happy to get a copy of it in my hands. Thank you for the work that NAMI does nationally. So if we can get started with the presentation. Next slide, please. So let's just get started. Here's a poem that was written by my friend and colleague, Imani Harrington. Imani Harrington is a playwright, an artist, poet that lives in San Francisco. And we wrote a book together called Positive Negative Women of Color in HIV and AIDS. We need you, our brothers, our sisters, and our people. Help us reaffirm ourselves in loving ourselves. Hold us when we can't stand, because soles of shoes have traveled on our backs for so long. We need you, our brothers, our sisters, and our people. Thank you. Next slide, please. Keep going. So, unfortunately, the situation that we're dealing with right now is pretty dire. We know that Black and Latinx people and people with mental illness are dying 25 years earlier than the rest of society. And there's a lot that we need to do to change that. Next slide, please. For Black and Latinx communities, we are still needing to address things like stigma and discrimination with mental illness. Again, as Dr. Duckworth mentioned, COVID has unified us in a sense, right? So that people struggle. We know that people have struggled. We know that, COVID has really brought to light what mental health means. But we also know that for many people that have major challenges with their mental health, the stigma and discrimination continues to be something that's very real. We need more positive messages. We need more people that are out like me, as well as others that are out about their own mental health experiences across the board. We also need to make sure that we are doing our best to improve healthcare improvements for all, and particularly for Blacks and Latinx. We need to find ways to enhance the issue around trust in the healthcare system that sort of plagues our communities. One way is by bringing in and supporting more providers with diverse racial and ethnic backgrounds, and developing more clinical staff trained in providing culturally responsive care to our communities. And then we need to make sure that when people are seeking mental health services, that they have access to it, and particularly folks with private or no insurance. Next slide. So introducing peer support. In an ideal world, we could all provide peer support based on our life experiences. We do it every day, different issues, but similar results. I know for me, as a person I was in my 40s, having my first child, I needed peer support from other moms about what is it like to be a new mom, and particularly what is it like to be a mom who's older. I also would have benefited from peer support when I was 16 and suicidal, and throughout my years of going to college when I was dealing with some major challenges related to my mental health experiences. Peer support has been defined by the fact that people who have life experiences can better relate and can consequently offer more authentic empathy and validation. People with lived experience can offer each other practical advice and suggestions for strategies that professionals may not offer or even know about. Next slide, please. So what are some of the gifts peer supporters can offer? And I say gifts because I think that lived expertise is a gift. The installation of hope, that hope is possible, particularly that's so important right now for many of the people who are dealing with effects of long-term COVID, et cetera. Modeling one example of recovery, you know, there are so many different ways and so many pathways to recovery, but having a model of what it could be and what it looks like is very helpful. Mentoring, coaching, engagement, and connection. The art of connection is huge. Some people just need having someone there that they can connect to about their mental health experiences, but also just about, you know, what is it like to live life on life terms, right? So, and then there's street smarts and navigating the system, navigating the mental health system, that is, for people who have never been through the mental health experience, knowing how to connect with it, how to access care, what's going to happen as they're going through the system is going to be really important. Community networking, and again, community connection is also key. And I also have here Lift as We Climb, which is a term, a phrase that was coined by the United Colored Women's League back in the early 1900s. And Lift as We Climb essentially means that as we are climbing the ladder of success, that we are able to grab a person's hand next to us so that they are climbing with us. And that's just really key to the work that we are doing in the field of peer support. Next slide, please. And, you know, here's just some initial evidence. And we've done a lot of work at Yale's Program for Recovery and Community Health under the leadership and my mentor, Dr. Davidson. So particularly, the outcomes are equivalent to non-peer support providers, with some studies showing slightly better outcomes with peer support staff. And that's earlier work by Phyllis Solomon and colleagues. Also, that longer community tenure in those receiving peer support in one randomized controlled trial. Peer support staff show ability to reach people who have more vulnerabilities or are harder to engage, and that's by my colleagues here at Yale, Michael Rowe and Dave Sells. But we know that we are only scratching the surface, and we are really encouraging NIH and other funders to support more research, because more research is needed to examine the effectiveness of peer support, not only in mental health, but across a variety of different fields, because we do know that it works, and particularly to examine the culturally responsive approach to it. Next slide. So introducing the Imani Breakthrough Faith-Based Recovery Program, and this is a project that's currently being funded by NIH via a UO1, but also we do programming through Connecticut's DMIS and SAMHSA through the state opioid recovery response. So we aim to promote healing, health and healing for ourselves and our communities. How we do this by creating a sense of unity, that we are in this together, creating a sense of collective responsibility through a participatory process. And key to the work that, you know, we do in community, but that all of us should be doing in community, really involves participation by those with lived experience, by family members, as well as by, you know, neighbors, policymakers, leaders, etc. Next slide, please. This is just a photo of some of my colleagues. There's my co-PI, Dr. Yana Jordan, who's at MIU, and these are just some of the pastors who are involved in the Imani Breakthrough Initiative. Next slide, please. And these are actually some of our facilitators, our Black and Latinx facilitators who we train to deliver the Imani Breakthrough. Imani takes place in 4 churches. That's 4 Latinx churches and 4 Black churches in the state of Connecticut. And we're really providing, while Imani was developed initially to help people who have issues related to opioid use and particularly addiction in general, we know that mental health is a huge issue for people who are using addiction. And so now is the time to make sure that we are not separating these issues, that we are impacting mental health as we are addressing issues related to addiction. Next slide, please. And this is just a quick overview of Imani, and you can feel free to reach out to me, but it's a 6-month process, which includes a 12 weeks of classes and activities focused on the 8 dimensions of wellness, developed by a lived experience researcher named Dr. Peggy Swarbrick, who's amazing, as well as Dr. Michael Rowe, in the 5 R's of citizenship. So we combine those two and we train people around those areas, as well as provide sort of wraparound peer support as well as community support. Every Imani project is facilitated by a person with lived experience, as well as a faith-based member of that church. Next slide, please. And so these are just some of the unique factors of Imani. One is that, we definitely have to make sure that we are doing the naloxone distribution. Is so important that we are able to save lives, and we have to do more of that. People are dying because of the opioid epidemic, and we really need to do better at reaching people. It addresses harm reduction, and harm reduction is really key to making sure that people have, particularly people who are continuing to use, that they have the supports that they need. Intensive wraparound coaching that is built on primarily issues around spirituality. And spirituality, as we know, is huge culturally, but I can bet that, many of your mamas and grandmamas are probably praying for you right now. Next slide, please. And this is just some demographic information about, some preliminary work from Imani. As you can see in this end of 1008, that the folks that we are really reaching are people who have some huge vulnerability. 74% have experienced homelessness, 65% experience violence as an adult. Many have experienced issues with childhood, physical, verbal, sexual abuse. As you can see, while the project does target Latinx and African Americans, we also serve white folks as well. The project is open to anyone who walks through those doors. Next slide, please. And Imani has shown some significant changes. So we know from baseline to week 12 that there were changes for people who came in with using substances, that at the end of 12 weeks, we saw changes in overall wellness across all of the 8 dimensions. And this was huge. And this is a huge reason why we need to continue to focus on the 8 dimensions, because it's not just about issues related to addiction and mental health for people. It's about being able to address all those different aspects of people's lives. Next slide, please. And the next slide relates to our citizenship measure, again, developed by Dr. Michael Rowe, and that's really across those 7 domains of citizenship, such as stewardship, civil rights, caring for others, personal responsibility. And again, you can see that there were increases over time from baseline to 12 weeks. Next slide. So what can we do, and what can we do today? And I'm going to start from the bottom. So the first thing is that, even though COVID may have sort of made the playing field, so that we're all sort of impacted, we do need to do more to stop the discrimination associated with mental illness and addictions. We need to fund peer support research and programs. We need to expand these programs, particularly peer support, to communities of color, and really focus on culturally responsive care. And we need to provide insurance coverage for peer supports and community health work. I think that's very key to the work that we're doing, but we do need more coverage and funding in that area. So thank you so much, and I appreciate being here with you all today.
Thank you, Dr. Bellamy, for highlighting these great examples of peer and community support, and for some guidelines on what can be done today.